how you doing? My name is Bailey. I'm going to be your nurse today. Upon entering the room, I'm going to go ahead and wash my hands and complete the QSIN. I'm going to make sure there's no clutter in the room, make sure that a trash can and a water pitcher is nearby. I'm going to make sure that the whiteboard is updated with the correct date, my name, and the patient's name. I'm going to go ahead and check and see if the patient has any lines or drains. And I do see that he has a IV in his right forearm here. I'm going to check and make sure that that has no drainage, no swelling, and it's not red, puffy, and it looks good. So I'm going to go ahead and start on my head to toe assessment here. I'm going to put gloves on. Okay, buddy, can you tell me your name? Okay, do you know where you are? Okay, do you know what time of year it is? Do you know the date? Okay, I'm gonna go ahead and have you turn your head that way. I'm gonna check for JVD. And go ahead and turn it towards me here. Good. I'm gonna check skin turgor. Okay, good. And now I'm gonna go ahead and start on your vital signs, okay? I'm going to go ahead and take your temperature under your tongue here. Okay. And your pulses, I'm going to check on both hands. Okay. And I'm going to go ahead and watch your respirations here on your chest for 30 seconds, okay? Okay, I'm going to go ahead and take your blood pressure. While I'm doing this, I'm going to stick this little sensor on your finger here. It's just going to tell me what your oxygen level is. Okay, your blood pressure is definitely elevated, so I'm going to go ahead and document that. I'm going to take this off of your finger here. Excuse me. While I have my stethoscope out, I'm going to go ahead and listen to your apical heart rate for a minute. Okay, and I'm going to go ahead and listen to your lung sounds every time I lay this on you. I'm going to have you take a deep breath for me, okay? Okay, now under this arm. Okay, under this arm as well. Okay, I'm going to go ahead and listen to your back here. Okay, and while I have my stethoscope out, I'm going to go ahead and take a listen to your belly. Okay, good. You've got some bowel sounds in all 4 quadrants there. I'm going to go ahead and take a feel on your belly. Tell me if you have any pain with this, okay? The abdomen is rounded and slightly distended. Mom, do you remember when the last bowel movement was? Okay, and do you have any burning when you go to the restroom, when you urinate? Okay, I'm going to go ahead and check the chest for symmetry here. Okay, and do you have a cough? Okay, I'm going to check the skin, make sure it's warm, pink, and dry. Okay, can you move all your fingers for me? Good. And can you tell me which finger I'm holding over here? Your pinky finger, okay. And over here, your thumb, good. I'm gonna check the upper extremities for any tingling, numbness, pain, puffiness, or discoloration. I'm going to check cap refill in all 10 fingers. Make sure that it is less than 3 seconds. Okay, can you squeeze my fingers? Go ahead and push. Go ahead and pull. Okay, now I'm going to move down to the lower extremities here. Check, make sure they're warm, pink, and dry. I'm going to go ahead and have you push against my hands. Okay, and pull your toes all the way up to your nose. Good. Can you wiggle all your toes for me? Okay, I'm going to see if you can tell me which toe I'm holding. The pinky toe? Good. And your big toe? Okay, good. And I'm going to check the lower extremities for any tingling, numbness, any pain, any puffiness, or discoloration. And it looks to me as though there is edema in both the upper and the lower extremities. Okay, buddy, I'm going to go ahead and go check my doctor's order, see if he has put anything in for that high blood pressure, okay? Okay, I'm back. So it looks like he's prescribed you labetalol. All that does is that it's a beta blocker and it lowers the blood pressure. So I'm going to make sure before I give it that his blood pressure is still increased. I'm going to go ahead and check his blood pressure again. Okay, the blood pressure is definitely still high. So I'm going to go ahead and tell you just a little bit about this medication. Just some side effects you may see. You may get a little bit lightheaded because it is lowering your blood pressure. You may have a slight headache. Maybe you might feel not so good, maybe a little nausea, vomiting. And you may lose your appetite just a little bit with this medication. Before I give it, I'm going to check and see if he has any allergies to this medication. I'm also going to check the armband, the name, and the date of birth. Okay. I'm going to make sure that matches my MAR. Okay, and I'm going to go ahead and do hand hygiene again. And put these gloves back on. Okay, this medication is given IV push. I'm just going to go ahead and insert it into your IV. So I don't have to poke it, you don't have to swallow a pill or anything like that. So I'm going to go ahead and uncap this IV. Make sure that it's not clamped, there's no kinks in the tubing. I'm going to go ahead and flush it and make sure that it is still intact. I'm going to wipe it with alcohol, and I've got the saline slush here. I'm going to go ahead and push that. Okay, good, the IV is still intact. So I'm going to go ahead and take my medication here, and I'm going to slowly push this, make sure there's no signs of pain while I'm pushing or discomfort. Okay, I'm going to discard that. I'm going to recap the IV with a new sterile green cap. And I'm going to go ahead and document how much was given and how the patient tolerated it. And this medication is due every 6 hours if the blood pressure is still increased. So I'm going to go ahead and report off to the next nurse here. Here we have a 4-year-old who was admitted to the hospital for nephrotic syndrome. He has some edema in his lower legs and upper arms, and he has some distension in the stomach here because he's holding on to some fluid. I gave labetalol 0.5 milligrams per kilogram every 6 hours, so you can still give it if it is needed. And what we just want to watch here with him is we're going to go ahead and do his daily weights, make sure he's not retaining any more fluid. We're going to go ahead and do strict INO, make sure he's putting out as much as he's taking in. And we're going to go ahead and do some blood work, continue to do blood work to make sure that the kidneys are functioning correctly. Okay, thank you very much.